μπορούμε να ξεκινήσουμε με την κυρία Madalina Iamandei, λοιπόν, η οποία μας έρχεται από την All.Can International και είναι η γραμματέας του οργανισμού. Ευχαριστώ πολύ.
Thank you so much. Good afternoon, everyone. So I'm Madalina Iamandei, representing All.Can International. Thank you so much, ΕΛΛΟΚ, for making this event possible and for hosting us today. Our presentation and really our details today is, the idea is to introduce ourselves really briefly, and I will go straight in. All.Can International, it's a global stakeholder community that is working for cancer care efficiency, and we aim to improve health outcomes for cancer patients around the world, and we do that throughout the entire cancer care pathway. So we do this by generating and promoting evidence-based and measurable improvements in cancer care research and policy. And you can see on the right-hand side a small house, and that is really, those are the values that are guiding our organization. And they have been developed as a blueprint for efficiency, which I would invite you to have a look at on our website. And our principles are largely based on putting the patients first, adopt a whole system perspective, and promote multi-stakeholder collaboration. We've heard these words many times throughout the conversations today, and I'm happy to encompass all these values in our organization too. All.Can is present in 21 countries around the globe, so we are not European-based, we are a global organization. And our community includes actually a member or a national initiative of Greece as well. And ΕΛΛΟΚ, it's actually one of the main drivers of this organization of All.Can Greece. And we are very honored to work with them and to have them as part of our community. And one of the projects that I wanted to highlight today and to bring to your attention has to do with efficiency metrics. This is something that we have dedicated a lot of effort to in the past years, and this work has started in 2021 with an efficiency metrics study, which was actually conducted or coordinated by Matt here in collaboration with the University of Southampton. And this study is trying to uncover those metrics, those indicators that would help international stakeholders measure efficiency in their systems. We have come up with over 130 metrics. We know that is a lot, so these were distilled to 8 core metrics over 13 themes. And the study was completed in 2022. It's, again, available on our website, so you can have a look through. It's a very good piece of evidence. The second stage of this project was to develop a policy heat map, and what we've done here was to look at national cancer plans and have a gap assessment of how these efficiency measures that have been highlighted in the blueprint and the indicators, the 8 core metrics indicated in the metrics study, have been embedded in national cancer plans or other health policies. This tool is already available online. It's a digital tool, and again, Greece is part of the heat map, so I would invite you to check it out. Now we are in the third phase of the project, and here we are working to develop an implementation guide, an implementation playbook. This will help stakeholders at national level to adopt and implement these 8 efficiency metrics for their settings. This research is done in partnership with the University of Amsterdam under the coordination of Professor Nick Klazinga. And the playbook is on its last phase of development, really, and it's set to be launched in April this year. The next step after we have the playbook would be to start piloting implementation. And the reason why we would like to present to you the work, even though it's not ready yet, is to have you consider this opportunity. With a new cancer plan, it would be a great timing to have these 8 core metrics implemented in oncological settings and see how it works, if it works. Moving right into the description of the project, as I said, the playbook is not ready yet, but the research is undergoing. And what we have in mind as a conceptual overview is really to take these 8 core metrics and test them, assess them again against healthcare systems and understand if they can be used and how they can be used. So there is a fitness for use consideration, and for this we have clustered the 8 core metrics into three clusters, which I will explain in the next slide. And then the second consideration is the fitness for purpose. So what are the decisions, what are the prerequisites that need to be in place in order for these metrics to be adopted? And the outcome that we are looking for, as I have mentioned, is to have some implementation strategies, some recommendations that the researchers will make to guide stakeholders in order to adopt the metrics at national level. As I said, there are 3 clusters, and the boxes that are colored mark the core metrics, and these have to do with time dependency, and here we have time to diagnosis and primary care interval and so on. I will not go through each and one of them. Then we have workforce-related metrics and patient experience metrics. We do have some interim results, and we can already illustrate some of the challenges that the researchers have highlighted through the interviews that they have done with all the national initiatives, including Greece. And we can see that for most, or for all categories actually, metrics are not really systematically collected in any of the countries. Even though for patient experience, for example, the awareness of the importance of these metrics is there, and there are pilot projects taking place in some of the countries, they're still not system-wide implemented and monitored at this point. I wanted to give you a bit of a flavor of what the playbook is going to look like as well. So it's not a linear structure, it's not a linear book that starts in point A and finishes in point Z, but it's one where you can actually choose where to start. So it's very interactive, and you can start with what are the metrics, and there you can read everything about these measures. Why do we need to implement them, and how do we need or how can we implement them? And on the how, I think this is the biggest and the most important category of all, which will contain the recommendations issued by the researchers, but also good practice examples that have been collected throughout the All.Can community, the international community. So in the interviews that we have done and through literature reviews, we have identified examples of cases where metrics have been implemented, some of these metrics have been implemented, and how that has happened in practice. So you would have some very pragmatic cases to look at and understand how they can be applied in your own local system. And I think this is it for me in terms of presenting and showcasing the playbook and the metrics itself. One of the case studies, actually, it's going to be the HVA project, which Matt is going to talk to and about in a second. So I will just make this transition very smoothly and invite Matt to tell us about their project. Thank you so much for your attention.